People with dementia can maybe only concentrate on one thing at a time, but there's so much happening. There's people crying out in pain, there's people cursing and swearing, there's trolleys rattling about, and people with dementia don't like noise. So it's a maelstrom of things happening, and you just get more and more distressed. So it's as if you've died and gone to hell.
Usually when I go in with James to A&E, I'm allowed to go with him. I have had occasion where I've not been allowed to go with him. The barrier just goes up. They don't ask why do you need to go with him, which would be helpful. We're guided into a room, a cubicle maybe. Sometimes he's just left in a trolley outside and people walking past. Sometimes it can be quite lonely because if James is in a lot of pain, he's lying, it's maybe during the night, he's trying to sleep and you're sitting there, nobody's coming near, they say, oh, doctor will be in, and you wait and wait and wait. And I understand A&E is very busy and they have priorities to deal with, but somebody just to pass by and say, is everything okay, would make a big difference.
You want someone to feel safe when they go into hospital. I think that's the biggest thing for people with dementia, and for their families to be recognised, their carers to be recognised and helped through that pathway.
Staff were quite keen to look at the care that we deliver to to dementia patients in the emergency department. So we recognised this and we thought we could deliver something to them to help them look at their own practice and perhaps change practice as well.
We've had very positive feedback from completing this project. Staff have really learned from one another. They've really enjoyed working through the workbooks, and it has changed their practice, even from the little smallest things that we may do. They now give it a little bit more thought and think, right, I could do that, and this would make the patient's experience better and their journey smoother.
It's a great way of bringing staff together to discuss ideas, and I think that as a facilitator as well, you gain a lot of knowledge of teaching and just learning more about your staff and your patients.
Looking very closely at rota planning, I would say, was key to all of this to make it successful. We had to ensure that we were involving staff who had a high level of motivation initially, and that spread the enthusiasm for the course, and that has rubbed off on the course participants.
I think the challenge to the staff is that they feel they need a greater understanding of people who present with dementia. There's a sense of frustration sometimes, particularly if these people attend on their own without any carers or family members, and therefore they feel they want to get a better understanding of how to care for these patients, because at the end of the day, nurses want to care for every patient that attends on an individual basis and provide a good, safe, effective, person-centred care, because that's what we're all about.
So 95% of the participants in the research said that their confidence levels have soared. Their knowledge about dementia, if you take it on a scale of 1 to 5, a lot of them started at, they thought, level 2, or we know enough. But they done the programme, and it's up at 4 and 5 for their knowledge and skills as well. And it's shown that they're actually changing practice and keeping the changes going.
Well, I think we can already see some of the impact from the training, in that we can already hear people talking about how they're looking after patients with dementia and patients with frailty. Already on the workplace, I hear conversations between nursing staff that I didn't hear before, conversations between nursing staff and junior doctors that I didn't hear before, and just that raised awareness of what a patient's needs are and what a relative's needs are.
I think this training sounds wonderful, and I would hope that our local hospitals would be on board with that, because it would just make such a difference to people with dementia going into A&E.
I feel it was long overdue, because while nurses are caring, compassionate, they don't always understand. There's so much to learn. They might not get trained about dementia, so it's good that there's training available for them to do their job. They want to do their job better. When I've been in, they're willing to get better, but they do need trained.